All right, at the State House today, listen up. If you've ever had a medical procedure that required you to be unconscious, you might want to take a listen to this story.
A new proposed bill wants to limit what can be done to you while you're sedated. 13 News State House reporter Emily Longnecker is here to explain more. Em?
Well, at the heart of this bill are questions about what is allowed to happen to you during a medical exam when you're unconscious. Right now, Indiana does not have a law that expressly prohibits doctors or medical students from performing exams on you that you didn't consent to before you were sedated. The bill's author, Republican State Senator Mike Crider, says it's about protection for doctors.
Essentially, the bill is trying to protect medical providers and others from getting in a situation where somebody feels like a procedure has been conducted on them without their consent.
Crider says the bill also protects patients. If Senate Bill 90 becomes law, it would become illegal in Indiana for doctors, including medical students, to perform a rectal, pelvic, or prostate exam while a patient is sedated, unless the patient has said it's okay first.
I have had countless individuals come to the State House and ask to please pursue this. The reasons being is many people wake up and they find out that they've had these tests and they are traumatized.
Democratic State Representative Carolyn Jackson has filed the same bill during the past 5 legislative sessions, but says her bill never got a hearing. Jackson told Wednesday's Senate committee she's glad to see this bill moving forward.
The reality is physicians, residences, they don't know what kind of trauma these individuals have had in their lives. And when they found out a whole team of students have performed test after test on them, they are extremely emotionally upset.
The bill also received support from the Good Trouble Coalition, a grassroots public health and advocacy organization that focuses on improving health policy.
These should only be done by the care team for the benefit of the patient. This care team can and should include medical trainees when appropriately supervised.
20 states already require patients before going under to sign a consent form dealing with intimate exams. Federal guidance requires written consent before performing these exams for educational and training purposes. Senate Bill 90 would bring Indiana in line with that guidance. Senate Bill 90 passed out of committee today by a unanimous vote of 12-0. At the Indiana Statehouse, Emily Longnecker, 13 News.
And Senate Bill 90 heads to what's called a second reading, where other lawmakers can offer changes to it that ultimately have to be voted on.